So during your rotations, your preceptor, often a upper level executive, they are constantly serving as a mentor to you. You're meeting with them weekly. You're getting feedback from them. You're expected to get feedback from them. So I always thought it was very important to solicit feedback at every one-on-one because I want to improve every time.
Hi, everyone. It's Vrushangi Shah with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am so excited to be joined by a fellow from UPMC, but also a peer from my undergraduate institution, Chesna Panicker. So excited to have you, Chesna.
Thank you for having me, Vrushangi.
Yeah, so let's just kick it right off. Tell our listeners a little bit about your background, where you went to undergrad, where you went to grad school,
Yeah.
what your journey has looked like.
Yeah, so my name is Chesna Panicker. I'm currently a senior practice manager overseeing 4 primary care practices in the greater Pittsburgh area, still at UPMC. I just completed my 2-year administrative fellowship here at UPMC. Just a little bit about a background about myself. Personally, I was born and raised in St. Louis, Missouri, out in West County, and I went to undergrad in St. Louis University and also pursued my master's in health administration at SLU as well. SLU is what we like to call St. Louis University. And I was actually a part of the accelerated MHA program. So it was a 4+1. So I completed my master's degree in 5 years instead of the traditional 6.
Incredible. I love to hear it. Yeah, we'll just refer to it as SLU moving forward. Just much easier that way. And so tell me, internships, let's start there. They're a big part of undergrad as well as graduate school. And, you did 2 internships at SteadyMD as well as Cleveland Clinic. And so let's start with SteadyMD and tell our listeners, how you came about that specific internship and what that experience was like.
Yeah, so SteadyMD was actually something that I did during grad school, during the school year, before doing the traditional summertime internship in between your 2 years in grad school. So SteadyMD is actually, it was a startup company that it's a very unique telehealth company. They really did do a lot of outreach to patients, and it's kind of like concierge medicine in a way, like really trying to provide healthcare directly to patients. A lot of patients did not have insurance or they were underinsured, so we helped a lot of them, especially the ones that lived in remote areas, get referrals to specialists. So that was something that I did as an intern. It was really important for patient care and contributing to the patient experience. And it's still a thriving company today.
That's incredible. And I think, getting that startup experience is so unique and not everyone has that opportunity. So I'm really glad you were able to add that to your toolkit. But with that, you did a traditional summer internship, which is required of many MHA programs, and you did it at such a wonderful organization, Cleveland Clinic. So share with our listeners a little bit about that and why you ended up picking Cleveland Clinic.
Yeah, absolutely. So I think SLU's MHA program does a really great job of providing so many great resources and talks to us. So we had a lot of SLU alumni, as clearly like we are even here talking today. So there was a SLU alumnus that did talk to us he was a fellow at Cleveland Clinic at the time. And he spoke to us directly, did like a private webinar for the organization. And we had several of those in our professional development class. So as a part of that, I was interested in Cleveland Clinic as their internship, as many other organizations as well. But when I talked to him, it just felt right. And I was particularly interested in Cleveland Clinic Children's. So luckily, I got that through interviewing and just showing my interest. And Cleveland was a very similar city to St. Louis, so it wasn't too different moving there for the summer as well. I also liked that it was a cohort model, so I think my interest did show through the interviews, and luckily I had a great experience too. Great support at the organization, whether it came to leadership of Cleveland Clinic Children's, the leadership of the fellowship and the internship programs, and my co-interns as well.
Yeah, absolutely. And, I obviously did not go to SLU's MHA program, but we were together in undergrad. And I think SLU, just little shout out here, gives such, a dedicated approach to their student body, especially in kind of the health admin, public health spaces. So I
100.
completely understand what you're saying. SLU graduates, especially from the MHA program, are so well prepared, and definitely not luck. I think it was, your talent and your hard work that definitely landed you over at Cleveland Clinic. And of course, in a fellowship, which is kind of where I want to take this conversation next. So, before I even ask you specifically about your fellowship, tell me, and our listeners, why fellowship? What drew you to even go through the application cycle? And then kind of building off of that, would you be willing to share what that journey was like for you? Maybe how many places you applied, what the interview process was like, and how you dealt with that journey.
Yeah, it's actually so crazy thinking about that time when it's like 3, 4 years ago at this point. But it was a beautiful journey. There was, of course, times of struggle and times of stress. I guess I'll start with my journey into health administration in that realm in general. So um, I think a lot of people get into health administration, health management as a totally, they start wanting to be a clinician of some sort. And then they realize that there's another side of healthcare. And it was similar for me. But I actually knew in high school, luckily, that I wanted to do my journey in health administration in that realm. So
Wow.
between our junior and senior year of high school, I went to Marquette High School in Chesterfield, Missouri, out in West County. They had like a shadowing program. So I was labeled as like a future pediatrician during my shadowing experience. And then I left as wanting to be a future healthcare administrator.
Wow.
Because we spent a day with the VP at St. Luke's Hospital. That's where I did my shadowing experience. And that was the first time I had seen that side of healthcare, because I always thought everyone in the hospitals and everywhere in the doctor's offices that you see are people that are directly impacting patient care, frontline staff. So that's why, like in high school, like you're thinking that's the only part of it, but there's so much more to that. So that's when I was starting to look for programs that had both undergraduate and graduate opportunities in that realm of health administration. So then that's why I saw that SLU had, it was one of the few programs that had health management plus a health administration option for me at the time. Now it's definitely grown, but at the time it was not as common. And I was local anyway, so it just felt like this perfect opportunity. And so that's kind of what started my health administration journey in general. But when it came to, because it was so fast and I did the 4+1 program, I didn't have too much healthcare experience, which really made me want to do an administrative fellowship, especially something that was rotational, that gave me exposure to several different areas and aspects of the health system, not just within the hospitals, but I was very interested in outpatient facilities as well, which is what I'm in right now. So it clearly does show that it works. It helps having a fellowship that gives you exposure to different things. And when it came to the process, once again, like when SLU's MHA program gave us a lot of resources, we would get so many different emails from our professional development team at SLU, sending us different opportunities at different organizations all across the country. Primarily, I would say in the Midwest, South, Northeast, some out West too, but primarily I would say Midwest and Northeast were probably the most common ones that we would get in touch with, because that's where a lot of SLU alumni were. Yeah. And so we had a lot of different talks, personal webinars. They also encouraged us to attend a lot of webinars throughout on LinkedIn and connecting with fellows. And I definitely wanted to take advantage of that opportunity and to take that opportunity to network with other people. I also took part in case competition. So I did meet a lot of people through those events as well. So I think it was a process. I really thought I was going to be sold on pursuing a pediatric fellowship, because I did Cleveland Clinic Children's. I was like, I really do like peds. I thought I was going to do a pediatric fellowship. Most of the ones I did apply to were pediatric. So besides Cleveland Clinic and UPMC, the rest of the ones that I had applied to were pediatric fellowships or had some kind of aspect of peds to it. I applied to, I think it was 7. I didn't want to go more than 10 for sure, because quality over quantity. And I wanted to make sure that I was comfortable living in the spot where long term, I wanted to make sure that I was comfortable living long term in the city that where my fellowship was going to be, because I didn't want to leave right after the fellowship. I did want to pursue a career at an organization for as long as I could, at least. And Pittsburgh was luckily one of those cities that I didn't have any experience at all. And it's funny how I landed UPMC, because I luckily got 6 on-site opportunities out of the 7 that I had applied to. However, 4 of them were on the same day. So I had to make, I didn't get offers at the first 2 that I went to, and then the rest of the 4 were on the same day. So I had to pick 1 out of the 4. And I was actually driving home from class one day in the evening. I had an evening class. I saw a Pennsylvania license plate, and I took that as a sign. And I was like, I'm going to UPMC. Um, and it's crazy how everything ended up. But I'm really glad I went with that gut, because obviously it ended up working out. But also, when I got to UPMC's onsite, it just felt very at home. You could tell that, like, their reception the night before was at the Steel Tower, which is the tallest building in Pittsburgh, and it's at like the top level. And a lot of the executives are there. The fellowship alumni are there. The fellowship organizational, like the structure, like the leadership, is there as well. And they like embrace you with a hug when you first come, and it just feels very nice, because it just shows how robust the program is in total, and with such a large alumni group as well. I think at this point, our fellowship program, we've had over 100 fellows, almost 20 years of fellows. So the administrators and the executives all at UPMC are used to having people coming in and coming through. And I can talk about it later on, too, about like the reasons why I pursued UPMC specifically. But I just thought it just felt home, and I'm lucky that it worked out.
Yeah, absolutely. Okay, what an incredible journey. I knew, quite a bit about you, but I didn't realize that you wanted to pursue health management since high school. That's definitely a new thing. And, props to you for that, because I think, at least for me, in the South Asian communities that I grew up in, health admin was not well known. It was kind of like doctor or engineer or lawyer, a more traditional route, you
Mhm.
know? So it's hard going against the grain. So I, want to give you kudos. And, another thing that you said to me that really stuck out, not that it surprises me at all, is the fact that you had 6 final round interviews. I'm not surprised about that, but how crazy that 4 of them were on the same day.
Truly, we did a lot at that time. A lot of programs were on the NAFCAS schedule. Nowadays, a lot of them have moved away, but a lot of them were on that NAFCAS schedule. So I think a lot more coincided. But
Yeah, yeah. And, I believe in science too. And I think it's amazing that you saw that license plate. And, life has a way of working out. So I think obviously you made the right choice. And so, kind of, switching gears specifically now to UPMC, before I get into kind of, why you chose it and maybe the projects and your experience, just so our listeners have an overview. And you touched on this a little bit throughout this episode, but can you talk about the structure? So, I know you said it was 2 years and rotation based, but tell us more about that. What's the program mentorship or leadership like? And then do you have co-fellows?
yeah, absolutely. I'm more than happy to talk about it, because I really do love the fellowship structure at UPMC. So it is 2 years long. The first year, you're doing rotations and projects during the rotations. They range from 6 to 8 weeks for the most part. So I had rotations such as like a nursing administration, our leadership rotation, which is with one of the presidents of one of the UPMC hospitals. And then we had an operations rotation, which you spend with the VP of operations at the hospitals. And then we had rotations in facilities, our outpatient division. So we had a variety of
Hmm.
different rotations. And then the health services division fellows. we had also 1 week rotations because UPMC is so large. We're also an IDFS, so we have a health plan,
Mhm.
just similar to Kaiser, and we had 1 week rotations within the health plan just to get some exposure to it and have resources, especially with like different contacts and things. And then we also have a technological arm at UPMC called UPMC Enterprises. So we had a 1 week rotation with them. We had a 1 week rotation with corporate finance and telemedicine. And so we got a variety, we got so much exposure
Cool.
to all aspects of the organization, which is such a great thing that UPMC does because I still pull contacts from my brain from those rotations during that time. Um,
Yeah.
and then, so the first year is all rotation based and projects, and then the second year is you get an opportunity to manage people and manage teams.
Okay.
So what I wanted to do is I wanted to be a practice manager, and luckily there was a vacancy where I was put in, and I got to oversee staff, and I got to oversee staff during that year, and it was wonderful. So I oversaw about like 14, 15 people, and I still work with them today. And then I expanded my role beyond the fellowship. So your second year is really, they want to focus on people management, having direct reports, working on projects, something that's value add to you, but also a way for us to add value to the organization. So I really fell in love with primary care and the outpatient division rotation that I had earlier in the year. So I pursued that. And it was a great opportunity, and it really had helped my career soar from there. So I expanded my role currently. And so now I oversee 4 practices instead of 1. So I currently manage the staff at the practice that I was managing and then oversee the managers at the other practices.
That's incredible. And remind us, do you have
Oh,
co-fellows?
yeah.
Is that cohort?
Yeah, yeah. We'll go over the structure. So the structure of the fellowship program, when it comes to support and mentorship, they assign you an alumni person for a fellowship alumnus, and then you get matched with one of the fellowship directors. We have fellowship directors. There's about 4 or 5 of them now. We have expanded it. When I first started, it was just 3, but we have expanded it to 5 because we have regions and different divisions. So it was better to expand it. And then I have co-fellows as well. So in my year, we had 5 of us. So there was 3, including me, in Pittsburgh, and then we had 1 in Erie, and then 1 out in Harrisburg as well. So that was 5 of us. But we switch off every year of um, how many fellows that we recruit every year for our positions, because it's such a large organization and some regions recruit some years and some don't. But we recruit for Pittsburgh every year.
Got it. No, totally makes sense. And I was a regular growing up at Pittsburgh, and I always liked it. I think it's a very cool area, so totally understand that. And kind of like digging a little bit deeper into the fellowship, kind of a two-part question. Of course, you have that fellowship mentor who's like a former fellow, but what is mentorship like generally? Like when you're going through these rotations, were you able to identify executive leaders who you could kind of turn into lifelong mentors, and kind of what was that experience like for you?
Yeah, absolutely. So during your rotations, your preceptor, often a upper level executive, they are constantly serving as a mentor to you. You're meeting with them weekly. You're getting feedback from them. You're expected to get feedback from them. So I always thought it was very important to solicit feedback at every one-on-one because I want to improve every time. And also at the end of the rotation, we always had formalized evaluation. So we would, as fellows, would evaluate the preceptor and the rotation itself, and then the preceptor would also evaluate us as fellows, and then that would be sent to the next one, and then we would just improve on there just to evaluate your growth throughout the year. And another thing I think I forgot to mention earlier was that we got executive mentorship, like formal executive mentorship, um, during our second year of the program as well. So that did also serve as additional support. But yeah, absolutely. We have incredible executive leaders that I've maintained close ties with, and especially like not just the preceptors themselves, but the preceptors teams. And yearly we have that fellowship night prior to, and then that's when I engage with all of them in person again. So it's really nice to see them again and catch up on all the changes that have been going around nationally within healthcare and at UPMC as well. And I have kept in contact and very close contact with my one of the fellowship directors was my mentor, very close mentor, and I actually work on her team right now. She's like my boss's boss, so I do maintain a very close relationship with her as well.
That's incredible. And I think, a lot of the reasons why people do fellowships is for that mentorship and that, access and exposure to senior leadership. So I'm so happy to hear that, your fellowship kind of prepared you for that. And so, kind of a fun question, but any rotation or any project during your fellowship that was your like absolute favorite?
That's a really hard question. But at the same time, it's not so hard. I really did enjoy so many of my rotations. I
Yeah.
think maybe three of them kind of like they shine a little bit more to me because I just resonate with them a little bit more. My first rotation was the outpatient division rotation that I'm currently working in,
Yeah.
because it just resonated with me because I liked seeing all the outpatient workflow and
Mhm.
because like I think when I was younger, what attracted me to healthcare in the first place was how friendly everybody was in my pediatrics office.
Yeah.
And just like thinking back to it, I wanted to make sure that anything that I manage in the future would replicate that.
Right.
And I currently do manage offices that are very similar in that culture. So
Yeah.
I really did like that because it felt familiar, but it also what made me more passionate to want to pursue that kind of very caring patient care.
Sure.
So that's what brought me to that. And that's what really brought that rotation to light, I think, the most. And then I really enjoyed my facilities rotation. We had a rotation in facilities. So that's everything besides clinical care. So that
Yeah.
is environmental services, that's parking, that's food and nutrition. And I spent a day with some of the employees serving food to people. And I think that was just a wonderful experience being frontline staff at that point. And it was just wonderful to see not only serving employees, but patients as well. And I thought that was a beautiful experience. And I think we really do overlook all of the non clinical pieces in healthcare, whether that's outpatient or inpatient in hospitals as well. So I think the facilities rotation was very eye-opening, and also nursing administration, that was very interesting too, to see all kinds of different nurses, meeting with all of them, and hearing a lot of their frustrations sometimes during times of hardship. We
Sure.
were at the time transitioning one, like consolidating two different positions into one. It was like a care management type role, and there was a lot of pushback and at that time, but
Sure.
eventually it was the right decision to make from the organization. But it was so inspiring to hear all of their stories and knowing, and I got to sit down with a lot of them during my nursing administration to shadow them as well, to see what they're doing for their day to day. So
Yeah.
eye opening to see every piece that they do. They were tracking literally everything from discharge until when, from after they got discharged from the hospital, trying to organize their social work needs and all of that. So that was also eye opening.
Yeah, absolutely. All three of those sound like incredible experiences. And I think very essential to a fellow, someone who's an early careerist. It's important to go spend a day with EVS or go spend a day with nutrition services. I also did all of those things. So I definitely resonate. And, kind of my last question and how I want to round out this interview, you had an incredibly successful cycle for your fellowship applications. And so if you wanted to give advice to a candidate right now, or if there was something you'd go back and be a little bit more mindful of, what would that be?
I think it's really basic advice, but I know we always hear be yourself, but genuinely be yourself and just show what you're passionate about because that does really come through an interview.
Yeah.
I think I always say this to SLU students because I still whether I do talk to some of the SLU students sometimes throughout the years, but something that I really took seriously was the interview, because I think the most difficult part is getting from that first round interview to final on-sites
Yeah.
versus application to getting a first round interview. So I always recommend to record yourself speaking, and
Yeah.
just take your take your camera. It's going to be uncomfortable. Take your camera and record your video and audio, and or just audio, but I would prefer video and audio so you see how you look when you speak, and also practice that STAR method. I think that was also incredible, because I think I can ramble on and on sometimes. So then I think giving some structure to my answers, but not sounding too scripted, but sounding more authentic and genuine, I think is very important in the interview. And don't try to act like somebody that you are not, clearly. And it's okay to be a little casual at times, obviously. Do it in the most appropriate manner. You don't want to be too casual. You do have to steer clear from that, because you want to maintain professionalism in an interview setting. But I
Yeah.
think it is very important to record yourself and just see and check yourself how many times you might be using filler words. Maybe you might be playing with your hair too much. Things like that, little things
Yeah.
like that. So I would definitely recommend anybody to record themselves for sure. And also, I think apply to locations that you can see yourself being in
Yeah.
for a long period of time.
Absolutely. Location matters so much because, like, of course, the fellowship takes up a good chunk of your life, but you're going to have life outside of work too. So you might as well enjoy the city or town that you're going to be living in. And that's something I tell everyone all the time.
Mhm.
No, but great advice. And I think, kind of to the final note I'll say is I think being authentic, there's so much value, especially in this process, because you want to find the right fit for you. And the organization wants to do the same for themselves. So totally makes sense. Well, Chestnut, thank you so much for coming on the episode today. I know this episode, once our listeners tune in, it'll give them the opportunity to not only hear your great advice and, listen to your journey, but also hopefully apply to the UPMC fellowship next year. And again, it was a pleasure reconnecting and chatting with you.
Thank you.